webinar. I'm Skylar with Lean Frontiers, and today's webinar, How Medical Care is Becoming Accessible, Convenient, and Affordable, is the first of a FreedomDoc series. There will be a webinar within this series every month until October. For today's webinar, you will receive a link to view the recording. Please allow us 24 to 48 hours to get the webinar processed. On the screen, you can see Adam Habig. Adam is the co-founder of Freedom Healthworks in 2015 after witnessing the demoralizing impact of insurance-based practice on his parents, both primary care physicians. He serves as president and oversees the company's strategic initiatives. With that, I will hand it over to him.
Thank you, Skylar, and thank you everyone for being with us today. It's my pleasure to kick off the FreedomDoc webinar series with part 1 today. It has the unlikely title of How Medical Care is Becoming Accessible, Affordable, and Convenient. As they used to say, do not adjust your sets. Yes, you read that correctly. So thanks again for spending your lunch hour with me on this Thursday. We'll get right to it. A bit of a primer on this series, and for those of you who are, obviously everyone's new to this at this point, we're kicking it off, but these are a series of short lunchtime webinars to educate, evaluate, and really move stakeholders forward who are interested in the model. We're going to emphasize short, going to try to get you out of here on time today and not run over. But we also will start very broad today and then narrow in on future subject matter material. So again, today we're going to take a very high-level overview approach, and these guest speakers that we have following me will present on a variety of topics. The one thing that we do emphasize in order to get the most out of this series is please provide feedback, ask questions. I know a lot of you submitted questions ahead of time. Those were great. We're going to get into those at the end of the session today, as many as we can, at least those that were asked repeatedly by many of you. And those that we don't get to live, we will address in email and follow up. So please give us your feedback. Let us know what you got out of this that was valuable, what you didn't like. That helps us calibrate and curate kind of the next level of the curriculum, the next series. So tune in. And if you can't make an episode, that's okay. As Skylar said, they're available to review, but they are going to be built in somewhat narrative fashion, and one will build upon the other. So please do keep up and tune in and let us know what you like, what you don't like. Again, to kind of reset, and I appreciate the intro, Skylar, my name is Adam Habig. I am president and co-founder of Freedom Healthworks. I am not a clinician. I know we have a lot of doctors and clinicians on the webinar today. I am an attorney with a finance degree from Notre Dame. So I am approaching this and have been from the beginning of Freedom Healthworks from a very fresh perspective, and I hope that resonates today. But again, when we're looking at something like healthcare, and you say it's an absolute mess today, how in the world are you making it, how do you make it accessible and affordable and convenient? Really the hallmarks of any successful consumer services business. It takes a fresh perspective, and that dovetails in nicely to what Lean Frontiers is doing as well. You have to borrow from what works. It doesn't take reinvention of the wheel. As much ink has been spilled over this particular topic. It really just takes a bit of introspection and maybe looking across different specialties and seeing outside the medical industry, what's working, what can we import to this broken system we have today and see it work. And luckily it's happening. This is not conceptual. What we're going to talk about today, this is happening today, which is exciting. Healthcare is getting better at what you hear in the news. And we're going to talk about how that's happening. So again, that's a bit of background. Freedom Healthworks, again, was formed, as Skylar said, I guess it's 4 or 5 years ago now. Time flies. But it was a very personal experience for Christopher and myself. Chris is my brother. We started this company. And he is also not a clinician, but it grew out of frustration, as Skylar mentioned, watching what physicians had to endure today and how the travails and the different competing elements within the system were driving a lot of great docs out of the system. And that has ripple effects that detrimentally impact consumers and patients such as myself and such as many people listening today. But getting into the presentation, I hope you can all see this. I like to start with, let's jump to the last page of the book at risk of giving away the punchline and talk about today's takeaways. this is, I will try not to belabor these up front, but just so you know what we're going to be talking about, and they say the human mind can only 3, 4, 5 things away from any particular session. So we're going to try to boil this down. If you take anything away, focus on these items today. As I mentioned, number one, borrowing successful efficiencies and innovations from other industries can heal America's ailing medical system. It's happening. We're going to talk about how that's happening today and what we can do to continue driving that forward. But it is happening. And remember, that's how we get this done. One of those takeaway lessons, everybody talks about cost in healthcare. To lower cost, you must first know the price. I'll say that again. That's so critical. To lower costs in healthcare, you have to know the price. That doesn't happen in healthcare. And that's what drives a lot of the cost increases we've seen. Another major takeaway, and this would seem self-evident when looking at other types of consumer services, but often we forget that healthcare and medical care really is a consumer service, but eliminating barriers to access drives consumer satisfaction. And we'll see why the barriers that have grown up organically or otherwise within medical care have really detrimentally impacted that consumer access. So that's a third takeaway. And a fourth, this is not a session to beat up on insurance. It really is. You can tell from the title in terms of direct-to-consumer healthcare that we're probably talking about eliminating that third party in the room, that third-party payer system that carries a lot of the blame for what we're dealing with today. But let's talk about insurance as a great financial instrument as well. It absolutely plays a critical role, not just in medical care and in people's health, but in many different aspects of your life. It's a great tool, but it is a financial instrument. And we have to make sure we remember it is a financial instrument and not try to make it something else. And too often in healthcare, it's used as a currency for purchasing medical services when it should not be. So those are the 4 takeaways today. Don't worry about writing those down. We're going to see those again. But first, let's talk about the problem we face. And you do need to start at the beginning, and we're not going to go all the way back. I hope this is a Cliff Notes version of the barrels and barrels and barrels of ink that have been spilled over the years by people much wiser than myself when they describe what happened and what went wrong in healthcare. But you have to identify these problems if you intend to fix them. And I like to boil this down because we're comparing healthcare and medical care to other industries that are successful. When you look at the dysfunction within medical care, you have a situation. Instead of a normal transaction with willing buyers and willing sellers making a deal and each coming out of that transaction thinking that it was a win-win situation, you have a situation with wary buyers. And by buyers, I mean patients or consumers, very wary buyers who almost reluctantly enter into the marketplace. Almost, if you could imagine wandering into a Middle Eastern bazaar and you're afraid to touch anything you see because you don't know what they cost, there's no prices listed, and you're afraid to knock something off a shelf for fear of what it might cost. That's your average healthcare consumer today. So a very wary buyer and then a disgruntled seller. Physician dissatisfaction at record numbers today. I don't have to belabor that. Everybody knows, I know physicians get no sympathy in the general public in terms of their plight. But when you look at it, it's really not a great time to be a doctor today in the traditional medical system. So you've got a lot of disgruntled sellers who are providing these services, but not real happy about the way that they are forced to do it or what the hoops they're forced to jump through in order to provide those services. So you look at this equation, and instead of a normal functioning marketplace with a healthy transaction, you have wary consumers, disgruntled sellers, and the only outcome for that is a dysfunctional system. A lot of what we see in healthcare today arises from this dysfunction. We'll talk about inaccessibility. And really, what does that mean? Well, by way of example, ask a question. Do you think that they study the tax code at NASA conferences? Funny question, right? Actually, real world example. We mentioned that both my parents, primary care doctors with over 30 years of experience apiece, today they practice in a direct-to-consumer model. They practice direct primary care. But not so long ago, they were part of a large physician group, multi-state physician group, hundreds of docs. And I recall one particular weekend, this group pulled hundreds of physicians together for a weekend retreat. And you had this immense concentration of medical expertise, of talent, of experience. And you think, okay, what do you think they talk about over the weekend when they're all assembled? The best new therapies, the best treatments, what's cutting edge medical science? No, no, they talk about billing codes. They talk about the administrative quasi-insurance side of healthcare. And when I heard this, I thought that's insane. Do you think that NASA convenes conferences of their scientists to talk about the tax code? It's as silly as asking that question, but it happens in healthcare. And what that means is we call it the insanity of practice by billing code. It's not just that it really unduly limits the breadth of treatment options available, but it detracts, it drives physician attention and energy away from where it should be focused, which is what physicians are trained to do. They're focused on the patient, healing the conditions they're presented with, not frittered away on other types of administrative type activities. And so it really, in the end, by virtue of driving medical care through this third-party payer system, it grossly misallocates this immense talent that we have in this country, this enormous deep reservoir of medical talent, and it really fritters that away on things that are not core to the mission of healing patients. It also leads to burnout, physician shortages, and it creates problems with accessibility that direct-to-consumer healthcare helps heal, and we'll talk about why that happens. The second part is expense. I'll use another anecdote. Hey, Joe, what's the price of a new roof? AKA the most expensive way to buy anything, and it's with insurance. This is a story, a guy I know has a roofing company. I asked him one day, hey, I need a new roof on my house. What's that going to run me? And without even asking what the house looked like, he said, I'm not your guy, Adam. That's not my gig. Why not? Well, we focus on insurance-based work only. Well, why is that? Well, you could probably get your house re-roofed for $3,000, $4,000. We prefer to look for those issues or those jobs where there's been some hail damage or some other casualty, property casualty loss. And so instead of $4,000, we get to charge $12,000. Wow. Across the board, the most expensive way to buy anything is usually with insurance. And that's because one thing is missing in an insurance, a third-party based transaction. In that case, if it were my house that had the roof destroyed by hail, I just need a new roof. If someone else as an insurance company is paying for it, I don't really care what it costs. The seller of that roof, Joe, my buddy, the roofing guy, says, great, I'm going to jack my price up 300, 400% because this insurance company is going to pay it. And they become accustomed to paying that. And that's just the way it works. And the insurance company says, well, okay, we'll pay that because next year we know we're going to spread that cost overrun amongst our insured pool. So everybody sees a little premium increase to pay for Adam's roof. But also there's a notion that at the insurance level, that's how revenue is increased, right? Premium revenue goes up the more you can charge. And especially in healthcare, health insurance companies, because they're limited in terms of their net income, it actually works in a counterintuitive way. They have to drive premiums higher in order to create the ratio rise or the fixed ratio limits their net income. So they have to, in order to boost net income, they have to boost overall revenue. So there's no incentive to pull prices down when a third party is paying the bill. And we see that in healthcare, and that's why we've had runaway expense. The last piece of this is inconvenience. And really, we've all heard the adage, for want of a nail, the shoe was lost. For want of a shoe, the horse was lost. And on the battle was lost, the country was lost. It means that the lunacy of barriers to access have real world costs, both in terms of financial expense, but also quality of life and human cost. It's often said every year, people tout this stat that over a third of insured Americans, these are Americans with health insurance, skip necessary medical care because they're fearful. They're fearful of wandering into that Middle Eastern bazaar where they don't know what anything costs, and they're afraid of a surprise bill down the line. And also one more thing, when they need care and they call and the nearest appointment, the nearest appointment's 4 weeks away, well, I need care tomorrow. I can't wait 4 weeks to get in and see the doctor. So barriers to access like murky pricing or simply the inconvenience of trying to get in and make contact with a physician cause people to avoid the system, which leads to tremendous cost increases down the line. There have been some studies on that, and you talk about being able to prevent small things before they really develop into something larger and much more expensive. And it's a severe problem today. So these are three problems that hit, I think, squarely the issue of, why are we faced with what we have today, and how do we improve it? The culprit, and I've alluded to this, is that in many cases we're using the wrong currency to purchase medical care in this country. That currency that's incorrect is insurance. And so the presentation today and the webinar series will focus on what does direct-to-consumer medical care really look like, and why does it solve these three problems? Well, here's how it works. There are a few key components. And today, again, I'm going to use primary care as really the example. This does apply just the same to specialist care, although a little bit different. You'll see I'll point out some key differences when it comes to specialists, but by no means is this limited to only primary care. But there are several key components that are common across the board. The first of those is pricing clarity. And again, this seems self-evident, but in medical care, it's been such a difficult lift to get this any sort of price transparency. It's really the entire system in the insurance sense is built on lack of price transparency. So really trying to keep discounts and negotiated prices hidden. This turns that on its head. Direct-to-consumer healthcare, everything is clearly posted on the internet, on your practice website, on the wall of your your lobby when a consumer walks in. So pricing clarity is key, and recurring revenue, especially in the primary care sense, is critical. Recurring revenue is something that the business world has discovered and really embraced, and you see it all the time. So many consumer services today that used to be really purchased in a kind of one-off model are today wrapped into a recurring revenue subscription model. There are studies that say the subscription economy in this country has grown at 5 times the pace of the overall retail sales in the country over the past 6 years, which is immense. You see it everywhere. Again, we're all living in this now. I think it's a major shift among millennials to preferring subscription-based pricing models versus other types of models. But recurring revenue is a key part of the primary care component of direct-to-consumer healthcare, and we'll talk about that today and in some later episodes. A second is the convenience of on-demand services. And this is something else that, again, taken from the general, the success of other industries, other consumer service industries in our economy today. The convenience of on-demand services is paramount. And you think of, say, the Netflix model. There's a reason companies like Netflix moved away from charging per show, per movie, per unit to a flat monthly fee where the user has now eliminated, there are 0 barriers for a Netflix user to go in and see anything that Netflix offers, right? So that in itself delights consumers and in the end leads to really a better business model for the seller. So convenience of on-demand services is critical. And in medical care, this has been non-existent. I mean, what medical care other than emergent care has been on demand? Well, direct-to-consumer harkens back to that. And in a primary care sense, we set a metric that says, we're going to offer same day or next day visits. We're going to offer things like on-demand, virtual telehealth type visits. So this is reintroducing something that's been very successful in other industries to medical care, and it's been very successful so far. Again, 0 barriers, on-demand convenience is critical for consumer satisfaction. And the last key component of this that we'll talk about today is fully focusing the medical expertise at hand on critical issues. And this goes back to eliminating those things that are distractions, that siphon away energy and attention from these highly trained individuals who we need their focus on the critical issue at hand, which is healing the patient in front of them, not dealing with billing codes, not checking boxes, trying to paint by number when it comes to practicing medicine. There's a story I'll tell about a doc who, it's a great before and after story because he's one of the physicians that we serve at Freedom Healthworks, and he practiced before for many years in an insurance-based model. And he had the patient in mind that I'm going to speak of was with him during his insurance-based practice and after the transition to DPC. And this particular Freedom Doc for years had tried to solve this patient's sinus issues. And he'd thrown all kinds of pills at him, treatments, therapies, tests, you name it. And just without any sort of success, the guy kept coming back in. One of the problems was every time he'd come back in, this doctor was running 2 hours late, which is common in traditional medical practice. And he had about 12 minutes to try to figure out, okay, well, that didn't work last time. Let's try something else. There was never enough time to dig deep enough to figure out what's going on. So fast forward to after this particular FreedomDoc then transitioned to really a direct-to-consumer practice. And he said, okay, by golly, now we're going to have the time and attention to fix this. Sat down, I think gave this patient the better part of an hour, examining in a very Sherlock Holmes fashion all the different aspects of this particular condition with this sinus infection, this recurring sinus issue. Finally, in about, I think, minute 57, had that aha moment. And we call it the $5,000 pillow parable, because it turns out this particular patient, he discovered had an allergy to down pillows. And so the estimate was, wow, that was a $20 fix, when over the past several years, we've probably spent upwards of $5,000 on different sorts of medications, tests, therapies, you name it. That's the power of fully focusing medical expertise on healing and not just throwing pills at symptoms. So again, those are three key components of direct-to-consumer healthcare and how it works: pricing clarity, the convenience of on-demand services, and fully focusing on practicing medicine on the patient. There are some key omissions, things you don't see. And the first one, we've talked about it, there is no third-party payment. All right. We'll talk about in some of the FAQs, there were some questions about how does insurance interact with this. There always are questions around that, because health insurance is a great necessary piece of the puzzle, but we'll talk about where that works. But in direct-to-consumer healthcare, there is no third-party payment. Willing seller, willing buyer, clear pricing. Without third-party payment, you eliminate hidden charges and surprise bills. Every consumer that walks in that door knows what they're going to pay before they consume the service. So they're expecting, there's nothing they don't expect that ever comes out of left field. And that, in a sense, lowers the barriers to accessing the care for people who need it. There's no reason not to go consult your physician when you have an issue or a question. There's no need to worry about, am I going to get slammed with a hidden bill for this? Another key omission, no waiting on appointments or prior authorizations. If you need or you want to consult your physician, you do it. Questions, shoot them a text. Want to come in tomorrow, not feeling well? Come in tomorrow. It really is amazing when you reduce those barriers, how that absolutely increases both consumer satisfaction and the propensity to catch issues before they really develop into something more serious and costly and even life-threatening. So that's a key omission. Another one is we eliminate the misalignment of interest. And this is a tough one. I feel for doctors who are employed by hospitals who put pressure on them to hit certain referral quotas, or informally pressure these docs to always refer in-house, because that helps kind of feed them. For those docs, I understand why, we all understand why that happens. You got to, I guess these large hospital systems, they need to drive revenue themselves to stay afloat. But in this model, there are no misalignment of interests. Every doctor is beholden to one person only, and that's his customer, his or her customer. They're there in their back pocket for not just things that are occurring within the four walls of that office, but also things outside that office. So one of the biggest pieces of this that I think people sometimes overlook, as an attorney, I'll say this: you would never wander into court without counsel. If you were being in some sort of a court case, $30,000 on the line, you would always have counsel at your side. Many times, oftentimes today, people wander into the healthcare system and there is no one looking over their shoulder who knows how to speak the lingo, how to navigate those waters. Well, these doctors, that's what they become. Once they're a direct-to-consumer doctor or Freedom Doc, that's what they become in terms of advocates for their patients. So those are four key omissions that you will not see in direct consumer healthcare. And again, these all are harmonized, and you see again how one builds upon the other, and the importance of each one of those critical elements. So then here's an operational overview, and I'm going to check the time, make sure we're doing okay. Operational overview of this, and again, I'm going to focus on primary care today, but the same type of day could apply to specialty doctors as well. But a day in the life for a doctor: first of all, you have a predictable revenue stream. The prevailing model, the primary care level, is one of recurring revenue. It's a retainer-based model. It's a fee per month that you can adjust, for an adult, for a child, based on ages. There's flexibility there. And at Freedom Healthworks, we help physicians kind of find their sweet spot in terms of pricing. But it's a predictable revenue stream. You're not worried about who's walking in the door tomorrow in order to keep the lights on. It's a manageable patient load. So no more 30, 35, 40 patient encounters a day. You're talking 10 to 12, sometimes a little bit more, sometimes a little bit less, but your patient panel is also maxing out at 600 patients. Again, this is the primary care level. But because we're cutting down the patient panel, the value delivered to each of those patients, it increases immensely. Not just the time and attention, but also the access and the ability to fully focus on them when they are present. So predictable revenue stream, manageable patient load. A day might look like this, and this is one thing that we do, is we help physicians curate their daily schedule. So you might have a mix of brief, acute visits sprinkled between longer encounters, such as physicals, and remote telehealth encounters. This really provides the full gamut of value to the patients. So those that have a quick something to come in and get some stitches or something of that nature, you have time slots in your day to fit them in. You also have time built in for the longer encounters, a little more draining, mentally, I guess, some of these longer physicals, but they have to be done. So you hate to load up a full day of physicals. That would be a long day for a doc. And then remote telehealth, critical today. The pandemic really accelerated a move towards more physician contact remotely. So whether that's phone calls, secure messaging, video chat, those are built in because that's the expectation today of the consumer. It's often more convenient to try to hit that first rather than try to load either the kids in the van and come in. But again, it's up to the physician to manage how he'd like that cadence to operate. But that's a typical scheduling setup. And then also dedicated time built in for these advisory or advocacy type of activities. I mentioned that if you have encounters with the healthcare system outside of the four offices of your physician, that's what this doc does. He's there to help with those as well, guide you, avoid unnecessary expense, testing costs, guide you towards better types of specialists, better types of procedures. It's not always about finding the best value in terms of cost, because but again, that's there as well as a huge element. People always highlight the difference between getting an MRI that costs $400 versus $4,000. Well, that's one of the critical roles that the docs can play now, because they're liberated from the constraints that would have limited them in terms of where they can send patients. How about consumers? Very simple. You're talking about on-demand care, advice, and medical guidance from a trusted expert for a clear price. And I think that one sentence says it all. There was evidence, I think, in the British Medical Journal a couple of years ago about the effectiveness of seeing the same physician for a year, rather than popping in and seeing a rotating carousel of physicians on staff at a particular clinic or a hospital. The same doctor seeing you for a year increases dramatically his or her ability to understand your condition just at a glance. Instead of a doctor trying to rifle through a chart and understand what's happening within your health condition, this person knows you, and they know many things about you that you probably don't even know yourself. But it drove, in the BMJ journal, it drove a tremendous decrease in mortality and a tremendous increase in quality of life to have a physician who knows you as a patient. How about the financial side of this, making money? And again, today is just an overview of, again, how this works. I know in future series we'll go into details behind each one of these, but making money is always a simple equation, no matter how difficult you try to make it. It's your income is going to equal your revenue minus your expenses. In terms of your revenue in this model, again, the primary care level, you're talking patient fees that average between $80, $120 a month per person, plus some ancillary revenues, things that are not included in that membership, perhaps some different procedures or tests or things that many times Freedom Healthworks helps our doctors make these tests available where they otherwise wouldn't be. They might have to go outside the office for some of these procedures and tests. Well, we bring those in office and we deeply discount them so that the consumer has a better experience. So revenue is predictable, like I mentioned. It's recurring in many cases. We talked about the power of recurring revenue. Expenses. And this is where there are strength in numbers. Lean operations are key to direct-to-consumer healthcare. No more 4, 5, 6 FTEs per physician, where most of that support staff is non-clinical. You're talking about 1.5 FTEs in support per physician, because you just don't need 3 people working on billing codes for you in the back office. So lean operations, but again, very, very high touch and high value operations. Shared business services. This is something that we really focus on at Freedom Healthworks, is identifying those elements within other industries that have really succeeded with multi-unit business operations. Think your Starbucks, think your FedEx. Some of those operations are centralized. At your local Starbucks, they don't have accounting built in behind the counter. A lot of that kind of stuff we've centralized at Freedom Healthworks to help practices succeed and focus on the things they need to focus on at the practice level, at the office level. So shared business services are key to driving expenses down. And then business intelligence, being able to look at your numbers, look at your business, step back from it every month or so and take lessons from that. What do we need to do better? How can we fix this? How can we improve things? That's critical. In today's world, a lot of things are data-driven. It's very little thumb in the air anymore, gut instinct. So it's important to know which KPI to look at, how to analyze your success or lack thereof, and fix things before they become issues. The bottom line, people said that it's not what you make, it's what you keep. And I think it's usually referring to taxes, but in this case, we're talking about driving revenue into a practice, into a business, dramatically decreasing that expense ratio. So again, top line revenue at a full panel, 600 patients in a primary care setting, you could be looking at about $600,000 in top line revenue annually. Expenses could be 40, 45% of that, possibly even less. And I'm trying to be conservative here. So your net income, you can back into that, could be at full freight, full panel, north of $300,000. Now, not every doctor wants to have a full panel. I get that, and so what we allow you to do is kind of back into where you like to be financially, and we can set the parameters so you reach your goals. Obstacles: 3 reasons why doctors hesitate, because it sounds great, right? So where's the catch? Why isn't everybody doing this? Truth is, a lot of doctors are doing this. I think what Chris and I noticed when we got into it, coming from the business world, is that if there were 1,000 physicians who migrated to this model of practice, they took 1,000 different paths through the weeds. And so one of the goals we had with the FreedomDoc program is discerning the best practices from these kind of pioneer doctors who have done this, and building those into a pre-programmed, very well-trodden path where we can provide support along the way for those doctors who are perhaps a little wary of a DIY approach. But 3 reasons in particular that we identified that doctors hesitate to jump to this model. Honest question: how do I launch or transition my practice? Great question. One of the easiest ones for us to answer, because again, we've taken those best practices, but that can be a daunting obstacle for someone looking at this for the first time. How do I avoid the headaches of running a business? Again, we mentioned that very few people want to start a business and be a one-man show. There's a lot you have to do to succeed today in business. So part of what we do is build the programmatic pieces of this into these FreedomDoc practices so that you can avoid those headaches. And the economic risk. Everybody has this concern when they launch a business, right? What if nobody shows up? No customers. And how can I avoid starving while I'm launching the business and growing it? Both great questions, both questions that we answer through the FreedomDoc program. Just to hint at this, I think we're going to talk about it in future episodes, but marketing today is light years ahead of where it was even a decade ago in terms of sophistication. Consumer marketing, being able to draw from the best integration of digital advertising, social media marketing, traditional advertising, outreach, and coordinating that and targeting the right kind of consumers with the right kind of messaging is such a science these days. That's something that I don't know anyone in a small business on their own could ever get their arms around it. That's why there's strength in numbers with a platform like Freedom Healthworks, the FreedomDoc level. That's one of the services we provide, is to offer that kind of service to our customers where they wouldn't otherwise be able to grasp that sort of sophistication. Like I said, the series will illuminate answers to each one of these questions. So again, today's takeaways, and I'm looking at the clock, I want to save a little time to go through some FAQs. So by my math, we've got about 10 minutes left, but I will try to move in case folks have to jump early. Here are the takeaways again from today's session. Borrowing the successful innovations from other industries is key to healing America's ailing healthcare system. We've talked about a number of those, and in future episodes, you're going to get really into the weeds in terms of what those look like specifically and how they operate. To lower the cost, you must first know the price. That's a fundamental that I hope we all grasp today. Eliminating barriers to access will drive consumer satisfaction. And really, again, that is such a critical piece of this. Not just consumer satisfaction, it'll drive better health, it'll drive lower cost, a number of things. And removing those barriers is what has driven success in other consumer services industries that are flourishing today. Number 4, we talked about insurance. It's a great financial instrument. It's always going to be a piece of medical care and of the healthcare picture. It just needs to go back to what it should do, what it does in other industries, right? It guards against catastrophic economic loss. It's not there as a currency every time you need to put gas in your car or pay for an oil change in terms of auto insurance. It's not there for that. It doesn't do that very well. So we need to let insurance do what it does very well. And number 5, I added, direct-to-consumer care is today simultaneously lowering prices, increasing access, and boosting value. We talked about it mainly today at the primary care level. I know in future episodes, we're going to talk about how this is extended to specialty medicine, and then probably wrap the whole thing up and show in a sense how this can be really an alternative from soup to nuts in terms of how Americans derive their healthcare today and their medical care. So those were the takeaways. Wanted to save some time to talk about FAQs just briefly, and some of these were recurring, so we picked the ones that were most popular. If we didn't get to you, if we're not going to get to your question today, by all means, we will just follow up with us, and we'll talk. We'll handle it offline. But one question that came up quite a bit is how to minimize risk if you're a practice or a physician or a clinician looking to move this direction. And I'll harken back to those 3 bullet points that I mentioned before. Those are the ways that we identified, the best ways, I guess I should say, we identified to eliminate or mitigate risk in this endeavor. It's transitional risk, knowing which path to follow, what are the best practices, what are all the boxes to check legally, financially, operationally. It's half knowing how to start a business, it's half navigating the particular landscape that medicine entails. But when you talk about minimizing risk, I think we do a great job of being able to knock out some of the transitional risk, some of the business operational risk. Economic risk is always out there, and that's with any business. You cannot eliminate economic risk. That's the risk that nobody shows up, or you run out of money, run out of runway before you actually make it to break even and success. I believe we'll talk about this in some future episodes, but part of the FreedomDoc platform is addressing not just the operational and the logistical pieces of this, but also the economic pieces, whether it's some of the marketing platform services that we provide that drive patients into your practice, or some of the economic support that we actually have that we're about to launch, I think later this year, that will actually underwrite a practice that's launching and provide that capital support, so you don't have to worry about starving or making the mortgage payment or paying the kids' tuition. But those are the ways we see to minimize risk, and we'll be happy to get into more detail in future episodes. Big recurring question: how does this work with insurance and Medicare? Always question 1A, 1B. Checking time, about 5 minutes left. The truth is, when you carve the third-party payer out of this equation, they don't go away. They're still there. And in terms of catastrophic type of needs and the hit by the bus type scenario when it comes to insurance. Many of the practices today that we have will they'll provide invoicing if they need to their clients, their customers, and many patients have success if their particular insurance coverage is eligible or covers out of network type visits. They'll have success getting reimbursed. Now, we don't like to stand on that as a certainty, because it certainly isn't. I think that's the minority of patients in these practices. But again, it does happen. The key is that we say this is the kind of practice, kind of model that works with all insurances, right? That no one's excluded. It works with all insurance or no insurance. If you are uninsured, you pay the same great price that everybody does with the best insurance that you can buy to belong to one of these practices. It's direct to consumer. It's clear pricing. People, they love it. You leave insurance on the shelf for most other things. So if you do have to go to the hospital for something, or a specialist type visit or procedure, we'll talk about specialists in the future, like I said, but your insurance is still there to cover those kind of needs. Medicare operates the same way. A lot of folks, they look at this and say, well, you know, I really, they get a little nervous around Medicare patients. I understand that. We understand that. The truth is the senior population today, though, is one that is very willing in most cases to pay for the types of enhanced value that you receive through this type of program out of pocket. And until Congress gets their act together and someday it welcomes this type of innovation as really a cost control mechanism within Medicare, that's the way it's going to be. But by no means are you excluding Medicare patients from these practices. Really, no one is excluded from these practices. Patient attraction, we talked about that in terms of de-risking. How do I attract patients to my practice? It's difficult if you're on your own. It can be very difficult. Some people are natural salesmen and they fill their practice on their own. Others, it can be tough. We think the best answer is there's strength in numbers. You know, use an integrated marketing platform like the one we have for our FreedomDocs, and you'll see patients driven to your practice. And then you can work with us to help close the patients and enroll them. And the rest is up to you to provide great service and keep them as clients. How this model delivers cheaper care than the traditional model? Great question. People say, well, this is a more expensive out-of-pocket cost. Yes, it is. But we like to say, in 3 years of membership at one of our practices, if we can save you one ER visit or one urgent care visit, you've probably paid for your expense in joining this practice. If we can certainly keep you out of the hospital, even better. Now, our practices do allow, because direct primary care in large sense allows patients or consumers to dial back their insurance coverage. Sometimes they can save in terms of lowering their premium by dialing back their coverage, or many times they save on other out-of-pocket items that the practice directs them to, whether it's in-office dispensing or discounted cash pay labs, imaging, you name it. But it's amazing once you have a well-trained eye in terms of a physician looking over your shoulder saying, no, why don't you check over here, better pricing. And we provide the doctors with a lot of that support at Freedom Healthworks. It's amazing how much money you can save out of pocket in the end and really justify the cost of a membership here. But the big item to answer this one head on, how this delivers cheaper care, it spends more at the primary care level and it spends less at, say, the hospital level, because you're preventing those things from occurring, and you're keeping people out of hospitals for even not just catastrophic events, but more minor procedures that today a lot of times get referred into hospitals. They don't need to be. I'm going to move through these. I wish I had more time to get to the last couple. I'm going to move pretty quickly. Specialists, we're going to punt that one to a future episode, but I'm eager to hear. I know a lot of you could hear how specialists fit in this model. One thing to notice, there were questions about coexistence with the traditional health system, what's out there today. This is not meant to displace anything. This is simply meant, the direct-to-consumer model is meant to offer an alternative to physicians and patients who seek something else other than the monolithic system we have today. So that's a point to make there. The demographics of the patients and the customers in these practices, people think it's a rich man's game. Not necessarily. I think the average household income in a direct primary care practice is $95,000. So it fits all demographics. It fits all income levels. You find a lot of folks that see this as a priority in terms of their monthly spend, and I'm one of those. I agree. Employers are a big part of this. There are some great things happening, and maybe in a future episode we'll talk about some of the innovation occurring. A lot of people still get their health insurance through an employer, and there are some barriers with employers and some of the middlemen that operate in that space. But there are some amazing innovations happening with people around the country, with benefits advisors and experts that are building plans around this for employers. And we're right there at the centerpiece of this because, again, primary care is the foundational piece. And from there, you flow easily to specialty medicine. You have a referral base, and you flow to things like surgery centers and other cash pay items that really round out a full-fledged benefit. So I hope in future episodes we can talk about the impact of some of that and how the employers fit in. But one thing to note, many people say you need employers to succeed in this model. And while it's great to have employer support and bring patients in bunches, it's not necessarily a requirement. So I would advise that if you're looking at this, you can certainly build a successful practice based on the consumer market itself, not necessarily needing the employer market. I wish we had more time. I'm going to briefly go through the next webinar, or the next several, I guess, webinars in this series. The next one is concierge versus direct care, time and date on the screen. Then there's why direct care. Following that, we have beyond primary care, direct specialty care, and putting it all together for patients. All leading up to the first FreedomDoc conference this October. We're excited. I hope some of you are excited about this. But really, you'll get to see through this webinar series, all these things come together. And then the culmination is this conference, really bringing together primary care, specialists, surgeons, you name it, up and down the game. Because this is, like I said, this is an alternative model, top to bottom, that is really gaining steam in a hurry. So looking forward to that. So more information is coming soon. This is a great picture of me, and I thank you for being here today and listening. I'll leave you with the next episode, concierge versus direct care. So thank you for hanging out today. Hope you got something out of this. Look forward to your feedback.
Thank you so much, Adam. Thank you to everybody who participated in today's webinar and for joining in on our first one. So we look forward to seeing you for the rest of the series. Everyone, have a great day.